First to the Shark Tank stage, I want to introduce Dr. Sarah Buttar. She's representing Vione, the Medication Optimization and Polypharmacy Reduction Initiative from Cohort 3.
Hi, this is Dr. Sarah Buttar. I'm the concept developer and team leader for Project Vione, which is a medication optimization and safe de-prescribing methodology. It was started in Little Rock, Arkansas in 2016. Currently, I'm working at West Palm Beach, VA in Florida. We won the VHA third Shark Tank competition in 2017, that is Cohort 3. Vione stands for 5 filters that are used to stratify medications. Why do we want to do that? To change lives, to save lives, to improve patient safety and quality of life. Vione stands for the 5 filters are the medications vital and important to save lives? Are they optional? They do not make a difference whether you give or not. So V is vital and life-saving. I is important for quality of life. Optional is it really doesn't make a difference whether you give it or not. Not indicated is certainly they actually cause more harm, and every medication has an indication that is E. So we are an enterprise-wide disseminated project now. Our team won several prestigious national and international patient safety awards, including the Gears for Government Award, the Hero Award, the World Hospital Congress Award. It is in CPRS, it is in all VA medical centers. What started as a grassroots project in a 15-bed inpatient unit as of September 2024, we reached an impressive milestone. We impacted more than 1 million veterans. Thank you. Thank you. We stopped over 2.7 million unnecessary medications, and this is used by about 22,000 medical providers in 140 VA medical centers, and a conservative cost avoidance is $270 million US. So our project implementation very closely aligns with the core concepts of high reliability organizations. We engage leadership, focus on zero harm, create a culture of safety, and engage in continuous learning. I'm pleased today to introduce the first priority group, Accelerate VA's journey to being a high reliability organization with dignity bags for veterans. Let's hear from Emily Mendel from North Florida, South Georgia Veterans Healthcare System. Emily?
Close your eyes and imagine that you're a pack nurse walking down the hallway following a trail of suspicious liquid that's leading to a bathroom. You knock on the door only to find an elderly veteran and his wife in the midst of a serious incontinent accident. They had no supplies and no hope of getting out of that restroom without everyone seeing their embarrassing situation. Unfortunately, we've had many veterans experience this and then struggle to find a way to clean up quickly and still make it to their appointments. Unlike the inpatient settings, outpatient clinics are not set up with the necessary supplies to discreetly and with dignity address a veteran's incontinence. After scrambling to find the supplies to clean the veteran, Chris and I realized that we needed to do something. We came together to create the Dignity Bags. We funded ourselves, purchasing most of the supplies through the dollar store and places like that. We put wipes, briefs, gloves in a discreet bag that the veteran can toss over their shoulder and leave the bathroom with dignity. Our Dignity bag contains all the needed supplies that the veterans need during these embarrassing accidents. Any nurse, staff member, or volunteer can request a Dignity bag. Statistics show that 51% of adults over the age of 65 suffer from incontinence. That's 1 in 3 women, and 1 in 12 men. That could be any of us. We have spread this practice to 6 locations and providing 25 to 35 bags monthly to veterans and their families. We are asking your support to allow us to spread our practice to your facility. Accidents happen, and with your help, we can be there to support our veterans in their time of need discreetly, passionately, and above all, helping them maintain their dignity. Thank you.
All right. I was in one of my favorite restaurants the other day, and I was thinking back to a time when you couldn't just come here at your convenience. They were open reduced hours or even shut down completely during the COVID pandemic. My guess is that all of you have a similar memory of a favorite place to shop or to eat being impacted during this time as well. Now hiring signs were at every corner, and out of business signs were popping up everywhere. Our world as we knew it had been turned upside down. The luxuries we'd become accustomed to were slowly fading away. Now imagine if this was the case with your health care. You go to your local ER and they are temporarily closed due to a lack of staff. Now the ability to get your favorite sandwich for lunch on a Tuesday does not compare to not being able to receive emergency health care when it is needed, but the problem of severe workforce shortages impacted both the business world as well as health care. In March of 2022, there was a series high of 12 million job openings across the nation. VA specifically, in fiscal year 22, 62% of facilities reported a practical nursing shortage, and 38% of facilities reported a severe nursing assistant shortage. At the St. Cloud VA, we decided to grow our own workforce. Earn while you learn became our catchphrase, and veteran-centered care was at the heart of it. To date, we have trained and retained 26 nursing assistants, which is an 82% retention rate for those who have completed the program. This success assisted in reopening 47 inpatient CLC beds that had been closed down due to staffing. These extra beds resulted in a $24 million cost savings in VERA dollars and care being brought back to the VA. This is no big secret. We are in the middle of a nursing workforce shortage. We need to grow our own workforce and bring millions of dollars back to the VA. I can help you build just the right team, determine exactly how to make this work in your area, and then all you need to do is recruit. Thank you.
So what is PINS? PINS is a networking tool that has been developed to optimize vested funds, facilitating the trade of unusable, unreturnable medications and supplies. Why was it created? PINS was created to address this unfortunate reality of pharmaceutical waste by closing a clear networking gap and bringing to light just how much of an impact we can have by being proactive. It was designed to behave like a shopping platform, simplifying and automating the trading process. There are currently 195 sites enrolled out of the eligible 318. That's an engagement rate of 61%. PINS has plenty of room to grow. And why is that so exciting? Because within the first 38 days of operation, over $1 million worth of product was redistributed and utilized by other VHA sites. And within the first 8 months, that number has grown to over 3 million. In its current state, PINS has a $0 operational cost. It was built entirely on the free version of Power Apps for Teams. This includes the application itself in combination with multiple flows. PINS will also give you exportable data that will allow you to track your savings. So why bid on PINS? Because by maximizing our investments, we can find the funding to explore new innovations while continuing to fulfill the VHA mission.
All right, don't mess this up. So, they say if you've been to one VA, you've been to one VA. And at my VA, I've received world-class care, I've gotten surgery, I've gotten therapy, I even have a career. But you see, at my wife's VA, she's had a very different experience. She's worried about whether or not she wore the right dress that day because it might gather the wrong attention, or if she's gonna go through the front of the VA or some other entrance because she doesn't want someone to catcall her or tell her she's too pretty to be a veteran, right? Or if that does happen, is there safe and reliable reporting options? Crazy thing about it is that my wife and I go to the same VA medical center. We know that sexual harassment and sexual assault disproportionately impact women veterans and those in the LGBTQ+ communities. And as a result, many of those veterans are getting their care elsewhere. And this is a big problem because we know that VA gives the best care to all veterans. Frontline staff are familiar with this as well. Nurses and patient advocates, for example, many of them report that they can identify harassment when it occurs, but they're not quite confident or sure about how they can safely intervene. Well, this is where VA for harassment prevention, virtual reality for harassment prevention is being developed in order to help train those staff members to use evidence-based practices, such as bystander intervention techniques, the ERACE model, and soon to be PMBD, in order to create a safer, more equitable, more trustworthy VA experience for everybody who does business with us. Virtual reality for harassment prevention is an evidence-based training that is being developed by staff for staff. We've visited 16 VA medical facilities so far, and 8 more on the way. And all the qualitative and nuanced information that we're getting from frontline staff from all backgrounds is going into each version of this training. So it's not just novel, it's something that's going to be authentic and something that's going to be effective in helping people understand how they can intervene when they see sexual harassment occur at VA for both veterans and staff. So what I'm asking for everyone here today, and especially of you leaders, is to take time and train yourself on these interventions while this prototype is being developed. What we want to do is make sure that everybody has an opportunity to enjoy the VA the way it's meant to be. Another thing that you can do in the meantime is visit our booth here at Innovation Expo and make sure that we are all doing our part to help every veteran feel welcome at VA. Thank you for your time, and hopefully my wife and I can have the same VA experience next time we go.
Picture it, Mason City, Iowa, March 2024, rurality 99%. A veteran enters a virtual eye clinic for a routine visit. The ophthalmology technician sees the patient and determines their vision is normal, but something is off. The patient's eye pressure is significantly above normal. Going with her training, she immediately contacts the eye doctor on call, and they determine that the veteran has glaucoma. Now they have a treatment plan to save the veteran's eyesight. Had it been a mere 2 years earlier, there would have been no ophthalmology technician present, like in so many areas across the country. What makes this success story so special? This ophthalmology technician was trained through the VA AJACAPO iTech Workgroup Support, or VIEWS for short. Our goal is saving sight one tech at a time. VIEWS enhances the traditional on-the-job training for ophthalmology technicians in face-to-face and virtual clinics. Through VIEWS, we help non-certified ophthalmology technicians achieve their certification. This is done by providing them with hands-on training by their peers, access to study material, including topics that are not commonly seen in the clinic, and access to test prep material along with a supervised study group. Currently, there are 10 sites in our pilot. Of those sites, 5 of our technicians have achieved their certification. From the start of this program, VIEWS trained technicians have serviced 8,939 veterans and counting, saving approximately $3.1 million in care in the community costs. Are you looking to enhance your eye team with a well-trained ophthalmology technician and save care in the community costs? Join us by saving sight one tech at a time by scanning our QR code. Thank you.
All right, our next presenter is representing Flo from 2017's Cohort 3. So it's my privilege to introduce to you, he's a heck of a man, Dr. Jeffrey Heckman.
Good afternoon. My name is Dr. Jeffrey Heckman, and I serve VHA's Amputation System of Care as the medical director of the Regional Amputation Center at the James A. Haley Veterans Hospital and Clinics in Tampa, Florida. I'm really excited to be here to present the transition to our providing veterans with the soonest and best care. And I'm very excited for all of you to experience this and to see all the support and just raise the awareness for your own programs, because that's really what Shark Tank did for us. With Cohort 3 in 2017, we were able to present to everyone what we were doing at the Seattle VA in improving timeliness for care for veterans with limb loss and getting through that process to procure their prosthetic limbs and come back in for follow-up care. we created this end-to-end solution with frontline staff members. And in 2021, we continued that implementation. Following Shark Tank, we were partnered with Vision 12. So I was here in Chicago and up in Milwaukee, sharing what we were doing with Flow. And then continued to implement, working with Vision 9 and Vision 22. And then ultimately, we became an enterprise-wide implemented initiative. And now our the way that prosthetic limb care occurs at VA, at 154 VA sites, serving 30,000 veterans with limb loss with over 100,000 prosthesis prescriptions. And now, I'd like to introduce our next speaker, Dr. Shannon Wise from VA Alexandria Healthcare System, introducing boothless audiometry.
In 2016, I began my career as an audiologist at the VA Medical Center located in Pineville, Louisiana. I would leave my home in Leesville, passing by the local VA outpatient clinic. One morning I called for Mr. Smith, and I can't help but notice that he too came from Leesville. Realizing the VA has an outpatient clinic there, I began to wonder why we aren't offering services locally. Well, the clinic is a small, modular building, and space is limited. So the installation of a sound booth isn't practical. But I can't help but think to myself, there has to be a way to bring audiology to this rural clinic. Boothless audiometry is the way. Hearing loss and tinnitus are the top service-connected conditions among veterans. It's no wonder why audiology care is one of the most requested services. Yet, audiology doesn't have a presence in many of our outpatient clinics due to the need for a sound booth, space, and building limitations. So how can we overcome these barriers and improve the way we're delivering healthcare? By using boothless audiometry. So what is boothless audiometry and how does it work? We brought the audiologist to the local clinic, designated a quiet room, and had it sound treated. We utilize an ambient noise assessor to monitor sound levels during testing to ensure valid results are obtained. In 2020, boothless audiometry provided a cost-effective way for us to bring hearing health care to our outpatient clinics. Mr. Smith and veterans in the community are thankful to have access to convenient and quality care. Many veterans utilize the VA solely for hearing health care. When our veterans have a great experience in audiology, they're more likely to consider using other VA services. Boothless audiometry increases access to convenient and quality care. Bringing this innovation to your outpatient clinic is a powerful way to show our veterans we care and want them to choose the VA.
Imagine for a moment that you're a 90-year-old veteran living alone. You can't see or hear very well. Every doctor visit feels like a new medication is added. You can't keep it straight. The pill bottles keep piling up. The VA does pay through the Office of Community Care for a home health nurse to come and fill your pill boxes. But every few visits, it's a new face. Communication between the agency and the VA team is slow at best. Many older, sicker veterans like Mr. A need home health services for medication management. Did you know that in eastern Colorado, we pay out over $3 million a year for home health agencies to fill pill boxes? That number will only increase as our population ages. Brave Home Meds brings this service in-house. A VA nurse visits veterans' homes every 2 to 4 weeks to fill their pill boxes, check vitals, and review medications with the veteran and a doctor by video. This streamlines communication between the veteran and their care team and brings VA care to the veteran. When the brave nurse first visited Mr. A, he was a bit leery of another new face. But by the third visit, he opened an entire closet of old, expired, and potentially unsafe medications for the Brave team to review and dispose of. Our pilot, Brave Home Meds, shows that we can reduce medication management costs by over 30 to 50%. That's at least $1.2 million in annual cost avoidance. If replicated across all 172 VA medical centers, this could save hundreds of millions. But Brave is about more than just dollars saved. It brings VA staff into veterans' homes as their advocates, catching medication errors and connecting them to resources. This is our chance to own the moment, streamlining communication between the veteran and the VA. So please join us in insourcing medication management through Brave Home Meds. Let's bring VA care to the veteran.
Picture this. At a recent appointment, you and your provider decided to start a new medication. And while the clinic provided instructions, when it arrived in the mail, it wasn't quite what you expected. It was some auto-injector or something, and in the 36 pages of instructions, it had warnings, precautions, side effects, indications, administration instructions. It's hard to imagine not being overwhelmed. Additionally, one misuse or one misfire of this med could cost the VA tens of thousands of dollars. Specialty meds are expensive. Biologic agents account for 2% of US prescriptions, but are 37% of net drug spending. The medications I monitor can range from $2,000 to $150,000 annually for our veterans per year. Additionally, they're complex. They require close follow-up, and a lot of veterans need frequent monitoring to make sure they administer their medication appropriately and to manage side effects. At the Madison VA, when a veteran's prescribed one of the medications we monitor, they're automatically enrolled in the Centralized Specialty Medication Management Clinic, or CSMM, since that's a mouthful. At this pharmacist-led clinic, we provide close follow-up, provide detailed medication education, manage side effects, significantly contain costs, and prevent medication misadventures. Since starting CSMM almost 5 years ago, we've continuously monitored our outcomes. And when vets work with us, they're 25% less likely to discontinue their medications at 1 year due to side effects compared to usual care. This is primarily due to those pharmacist interventions to ensure appropriate injection technique and minimize side effects. So, more than 90% of veterans would recommend CSMM to another vet. Providers have expressed appreciation and satisfaction with the service. Veteran safety and care is improved. And we conservatively save more than $1.50 for each dollar spent on the clinic. We're at 3 VAs so far, and if you also want to support veterans using these meds, support your providers, and save money, start a CSMM clinic at your VA today. Thank you.
To begin my story, you need to imagine that you set up this great low vision rehab clinic in 2008, and all partially sighted and legally blind veterans need to drive up to 200 plus miles to you, round trip, so you can help them adjust to their vision loss with the goal to prevent depression and help them remain safe and independent. The sad reality for our veterans who do not see well generally cannot drive, and they were going without our VA low vision care. Also, studies have shown the advantage to providing low vision rehabilitation as soon after diagnosis is to prevent potential decline in functional ability. I began to think outside the box in 2011 because I had telehealth equipment, and VA low vision rehabilitation care is far superior to any services available in the community. Also, family members or friends of the visually impaired are more willing to drive a few miles to a local VA healthcare facility instead of several miles to a specialty clinic. Since 2012, my data shows by utilizing telehealth, our workload increased by 28%. But more importantly, this means we are helping 28% more veterans who were going without our specialty low vision optometry services by saving our veterans over 123,000 travel miles. So if Western New York has partially sighted and legally blind veterans who cannot drive to a low vision specialty clinic, then obviously there are several more veterans throughout every state across our country who are also going without VA low vision specialty services, and telehealth can be the solution. I continue to enjoy hearing how happy our partially sighted and legally blind veterans are when they receive our telehealth care, because veterans tell me they now know what they were missing. My goal is to help other low vision optometry teams set up telehealth services, because several veterans risk continuing to be denied help because they cannot drive. So here's where you come in. Build your team, and your partially sighted and legally blind veterans will come. Thank you.
I would like to share with you a pivotal moment in my pain management practice. I'm in a video visit with a rural veteran in such severe pain and distress that he's bedridden during the visit. He's tried injections, opioids, surgery, and has lost all hope and quality of life. When I offer virtual reality for pain management, his eyes light up, he has hope again. He says to me, "None of my non-VA doctors have ever talked to me about anything like this." And he felt that the VA really cares about veterans. After the VIPER program, this veteran's quality of life improved so much that his follow-up visit with me was from his office desk rather than from his bed. And he subsequently referred his brother, also a veteran, to the VIPER program. The problem that keeps me up at night is that oftentimes veterans referred outside of the VA, they're overprescribed opioids. And opioid overdoses sadly claim veterans' lives at roughly twice the rate of the general population. So we're thrilled to report that 100% of our veterans enrolled in VIPER stayed in the VA for their pain management and did not require unnecessary opioid prescriptions or costly community care referrals, which cost over $300 million last year. With VIPER, we identify veterans for the program and order an at-home virtual reality headset for the veteran. The veteran is immersed in an extended reality environment to help improve pain, sleep, mood by over 50%. A virtual physical therapy coach then engages the veteran in VA-based care, increasing participation by a whopping 43%. So let's keep our vulnerable veterans safe and re-engage veterans in pain with the VA for safer and better care with VIPER. I'd like to extend a special thanks to Shobha Rajaman Underhill, physical therapist and partner for this innovation, my daughter Zara Hussein for her VIPER graphic design, and of course VA Immersives, and Dr. Ann Bailey and Caitlin Rollins for their unwavering support and inspiration. Thank you.
Now, I'd like to introduce Thor Ringler. He's representing one of my personal favorite Shark Tank winners programs, My Life, My Story, a Cohort 2 winner.
Hey, it's great to see everybody here today, and amazing that this VHA innovation thing is still going on after 10 years with this consummate leadership of our fellows like them. Sorry. Okay, so when My Life, My Story started back in 2013, one of the first veterans we interviewed said this about the experience. As long as I've been doing things with the VA, nobody has ever asked me anything about my life. There was never anybody to tell because nobody wanted to listen. This is the first time. When his story and other early stories were added to the VA medical record, it was the first time that the voices of veterans, their stories, in their words, and reviewed by them, had appeared in the VA chart, in any medical chart. And when VA providers read those stories, it was another first time. In the words of one provider, "I've taken the time to read each my story I have encountered in my patients' charts, and I'm grateful to have the additional dimension and background to help me better understand who my patients really are." Our first interview was in March of 2013. 11 years and 10,000 stories later, we're still listening. VA staff, VA providers, community volunteers, and healthcare trainees are interviewing veterans and writing their stories at over 80 VA medical centers. And those volunteers and trainees are spreading the program beyond VA. Over 20 non-VA medical centers are now interviewing their patients and writing up their stories. But a first time only becomes a next time if you have support, which is why I am so grateful for the VHA innovation ecosystem, Whole Health, Veterans Experience, CDCE, and all the other VA offices and amazing folks who made this first time a next time for all our veterans. And that's why we're here today, after all, to support new innovations and applaud these amazing innovators. I'm excited to introduce our final priority group for this year's Shark Tank: support veterans, whole health, their caregivers, and survivors. Let's hear from our 11th finalist, Dr. Rona Rulova. Dr. Olova is from the VA Palo Alto Healthcare System, and she's presenting a director's pick, Fast Track PGX results.
Thank you. Hello. What if I say that each one gets a $1,000 gift card for attending this event, but everyone can only shop in this store? I bet very few will get excited. We individualize all the time based on our preferences: food, fashion, music, and movies. Why not also for our prescription medications? We can individualize prescription medications. By a simple blood draw, providers can now tailor their patients' prescriptions based on their patient's genes. The right drug at the right dose for the right patient. This innovation reforms the PGX return of results. The right drug at the right dose for the right patient at the right time. Using the Data Arch platform, PGX results will be pushed automatically into the CPRS notes in near real time. The current turnaround time for return of results is 7 to 8 days. With this innovation, less than 2 minutes. What is the value proposition for this? Over 5,000 veterans per month will get timely return of results. That means less side effects and higher efficacy. Over 9,000 providers will be able to tailor their patients' prescriptions without ever leaving the CPRS workflow. That means less burnout. And to the medical centers, imagine less waste for dispensed prescriptions that had to be discontinued because they didn't work. These companies had one thing in common. Their leaders failed to embrace innovation. I call out to the leaders in this room. You can move the needle in delivering precision medicine to our veterans. No more one size fits all. Thank you.
All right, so did you know that knee osteoarthritis impacts about 1 every 4 veterans? And the negative impacts of this condition are really far-reaching. Consider veteran Jones, who has knee osteoarthritis as a result of a military-related joint injury. Because he's unsure of how to adapt his activities to accommodate his knee instability and pain, he becomes more and more inactive, leading to functional decline. And that places him at a whole risk for a whole host of other negative health outcomes. Physical therapy is a powerful tool for reversing and attacking functional decline. But demand for physical therapy services in the VA is high, and that can limit access for veterans. In fiscal year 23, the VA spent about $260 million in community care for physical therapy. Group physical therapy for knee osteoarthritis is an efficient model for delivering care. It enhances access and provides peer support. Group PT involves 6 sessions that include functional exercises, individual tailoring, and educational content. It can be delivered in person or via telehealth, which also expands access. Group PT results in clinical time savings. For example, treating 8 patients with the group PT model can result in the savings of 42 clinical hours compared to the traditional group or individual physical therapy approach. We have evidence from multiple studies that group PT results in improved function and decreased pain. And group PT has already been delivered in 19 VA sites, so we're well equipped to help other facilities launch their own program. One veteran told us that group PT helped him to be able to get up from a seated position, something that's clearly really important for daily life. And he also told us that the group environment encouraged him to attend sessions. Some staff delivering the program told us that in their first group PT class, veterans not only improved their function and decreased their pain, but they rated the program a perfect 10. And these staff members really enjoyed delivering this beneficial program to veterans. Our team has developed all the resources you need to deliver a group PT program at your site, So join us in helping veterans improve their function by launching a program at your facility. Thank you.
Good afternoon. 23% of veterans returning from combat have post-traumatic stress disorder. Jared is one of those veterans. Following deployment, he is experiencing nightmares and drinking alcohol to avoid painful memories. In 2023, he was hospitalized on the inpatient mental health unit at the New Orleans VA after attempting suicide. Now, prior to this project, Jared's hospitalization would have focused on stabilizing his symptoms through medications and skills-based groups, but his memories from Afghanistan would continue to haunt him. Following discharge, he would have waited months to engage in outpatient PTSD treatment due to demand. The problem is most veterans like Jared do not have access to evidence-based PTSD therapies while hospitalized, because hospitalizations are a short 7 to 10 days and treatments are long, typically between 5 to 12 weeks, leaving veterans like Jared continuing to struggle with PTSD. We should be able to treat Jared's PTSD while hospitalized, so we did, using written exposure therapy, a 5-session PTSD treatment. While hospitalized, Jared confronted his combat experiences by writing about it every day. He was able to process the trauma in a safe environment, and it became less distressing. He was able to complete a treatment that normally takes 5 weeks in just 5 days. Jared and other veterans were assessed before and after completing this treatment. Consistent with other frontline psychotherapies, Jared and other veterans experienced clinically meaningful and significant reductions in both PTSD and depression symptoms. As you can see here, veterans are also highly satisfied with this treatment. The impact of this innovation is striking, creating immediate access to PTSD treatments during hospitalization, rapidly reducing PTSD symptoms in just 5 days, and increasing downstream access for other veterans in the outpatient settings. We are eager to deliver the best PTSD care to our veterans and ask that you all support us too. Thank you.
Individuals with a low sense of purpose have an increased risk of early death by 2.5 times compared to individuals with a high sense of purpose. So imagine as a healthcare professional, you assess for sense of purpose or well-being. How do you demonstrate changes over time? And how do you use that to inform your care for even better outcomes? Show it and use it with the Well-Being Signs Administrator Dashboard, a simple solution. This is Katie. She's our pain team's nurse practitioner. She says, I just wanted to say I did a repeat of the well-being signs today, and the patient had improvement from a 1.67 to a 5.73. He did physical therapy, got him in with pain psychology, some topicals. It was nice to be able to speak to it, even though he still has pain, that he can look at things in a more positive view, now seeing more joy. Show it. This is Katie's veteran's well-being story. Regularly involved in things, fully satisfied, functioning your best, a 219% well-being improvement in 3 months. I feel like I am seen, heard, and living my best life. Life is really worth living. Don't stop there. Use it and grow it. This is all veterans with pain and health coaching. A 17.7% improvement in well-being in 3 months. A big problem to a simple solution. We have successfully implemented the Well-Being Signs Administrator Dashboard in 23 facilities, and 20 are in progress nationwide. Help us help you. For some, let's get it across the finish line, and for others, it's easy as. Install the documentation templates, install the administrator dashboard, administer the well-being signs, evaluate. Oh, and it's free. A simple solution.
Thank you. Audience and sharks, let me ask you, why wasn't the shark afraid of getting stung by the honeybee? He had trained with the sea bees. Thanks. Now think about the last time you heard the buzzing sound of a bee or hornet. How did you feel? Anxious, afraid, panicked? But if you stayed calm, you most likely had that feeling go away. Military training and experience can leave veterans with anxiety and depression as they transition to civilian life. Many veterans during and after this transition find that working with honeybees can be beneficial to their mental health. Through the Hives program, veterans can use the skills they learned from working with the bees to manage their everyday stressors and mental health. The veteran begins by signing up for the Hives program with the Recreation Therapy program and arrives at the VA at the scheduled time to join 7 other veterans at the apiary. This is where the rec therapist guides them through yoga or meditation to prepare their mind and body for the beekeeping session. After putting on a bee suit and getting fully immersed in the care and education at the hives, and practicing mindfulness while working with 30,000 bees, the veterans experience a decrease in depression and overall changes in their health. When they leave the sessions, they are feeling less depressed and less anxious. It's pretty amazing that in 1 year, a colony of honeybees can pollinate 75% of the fruits and vegetables that we eat, make over 100 pounds of honey, and improve anxiety, depression, and quality of life for veterans. Sharks, I will leave you with this one final thought. Even though bees might make you nervous, combining yoga, meditation, and honeybees can significantly improve the mental health and well-being of the veterans that we serve. Oh yeah, and before I go, I have one last joke. What happened when the shark brought home a beehive? They made fantastic honey. Thank you very much.
I want to give a thanks to our past VHA Shark Tank winners for returning to host, and a round of applause for 2024 finalists.
You can check out each finalist on the Diffusion Marketplace to learn more and contact them to adopt their practice at your facility.
All right, so let's bring out our 2024 promising practices to the stage now to announce their bid selection. These are the facilities that the promising practices will work with to implement their practice and the next exciting step with Diffusion of Excellence.
VISN and VA Medical Center leadership submitted bids in hopes of implementing their innovation at their facility. This year, Diffusion received 29 bids from 19 facilities.
Our first promising practice is one of our director's picks. Fast Track PGX results with 7 bids. They will implement their practice across VISN 6 by way of Durham VA Healthcare System.
Woo! Yeah, come on, bring it in. You want to read off the teleprompter? No? All right. Then why don't you head over there, Rona? Thanks. All right. Our next promising practice is investing in VA nursing with 3 bids. They selected VA Central Arkansas Healthcare System in Little Rock as their implementing facility.
The next promising practice, low vision tele-eye rehabilitation, also received 3 bids. They'll begin replication in Danville, Illinois at the VA Illiana Healthcare System.
Dramatic pause. Next we have rapid treatment for PTSD in acute care settings, receiving 3 bids. They chose to join the Salisbury VA Healthcare System in North Carolina.
And a big congratulations to Boothless Audiometry, securing 2 bids, and they are heading to South Texas VA Healthcare System in San Antonio.
Love to Say it. Next, we have Dignity Bags for Veterans receiving 2 bids. They chose VA Sierra Nevada Healthcare System in Reno, Nevada.
All right, let's hear it for Hive's Honeybee Initiative for Veterans Empowerment. They also received 2 bids and will be implementing at the VA Northern California Healthcare System.
Another director's pick, re-engaging veterans in pain through extended virtual reality. Viper secured 2 bids and will be heading to work with the folks at the Central Arkansas Veterans Healthcare System. That was a lot.
It was a lot. Yeah. I'm a lot, and that was a lot. Next, we'll have Centralized Specialty Medication Management accepting a bid from the VA Illiana Healthcare System in Danville, Illinois.
Lastly, Well-Being Signs Administrator Dashboard will replicate that. Will replicate throughout Visit 8 by way of Orlando VA Healthcare System.
Look at these beautiful people. Congratulations to the 2024 Promising Practices. Connect with our finalists during IEX or through the Diffusion Marketplace to learn more about the great work that they're doing. Now for the proposal of the day.
I've wanted to do this my whole life. The 2024 proposal of the day winner is... Can I get like a drum roll or something? Rona Margaret Ralova with Fast Track PGX results.
Congratulations, Dr. Ralova. Thanks, everyone, for voting there. Thank you all for joining the 10th VHA Shark Tank competition.
Don't forget to tip your servers, stack the chairs, have a great